Isn't it incredible that 12% of the population and nearly 1 in 5 women suffer from migraine, and there are hardly any good treatment options? Furthermore, the best medication? Well, more than half the people don't even bother to refill their prescriptions. If you have migraines, you may have imagined having something that would help you learn to identify the things in your diet, environment, and life that influence your migraine, that teaches you the things that might help you to avoid migraine attacks, things that potentially trigger your migraine, and find things that may be protective, so that you can take positive steps to avoid a disabling headache, and also double-checks things that you previously thought were triggers, but in fact have no effect, so you don't have to give them up. Imagine a world where over time you could learn to control your migraine, and imagine having something that would actually warn you of a migraine attack in the near future, so that you have time to do something about it. Well, that thing is called Curelator Headache, and it is ready to help people understand their migraine and take back control. Some of the leading neurologists in the US and Europe collaborated on the development of Curelator Headache. It incorporates advanced patented analytical technologies that simply have not been available to the public ever before, and promises to change the treatment of migraine. The Curelator approach is unique in that it is specifically designed to allow patients to identify and manage the factors that influence day-to-day variation in their risk of attacks. Curelator gives patients individual information that they can use to help them understand how their migraine is developing over time. Information and understanding are key to effective management, and so much more powerful than just a prescription for medication. The journey to better health begins by letting Curelator Headache know your daily habits, diet, and lifestyle. Many things it can learn by itself, and other factors you'll need to take a minute or two every day to enter. But daily tracker apps alone are nothing new, and there are dozens of them flying around. What makes Curelator special? Well, 2 studies recently published in the leading migraine scientific journal prompted this observation from co-author Dana Turner. People who try to figure out their own triggers probably don't have enough information to truly know what causes their headaches. They need more formal experiments and should work with their doctors to devise a formal experiment for testing triggers. In a patented series of recently developed algorithms, that is exactly what Curelator does. You can easily access Curelator Headache platform through your laptop or smartphone. Log daily data and, if you want, choose and test triggers that you already suspect. Once a potential trigger or combination of triggers has been identified, Curelator Headache runs a rapid series of tests, at home, at your convenience. This unique approach leads you on a path of self-discovery. No additional drugs or pills, just you and Curelator Headache. In fall 2014, a large multi-site clinical trial will be conducted to validate Curelator's first-in-kind approach to help people with migraine discover and control the triggers that cause their headaches. Patients from leading headache clinics in the US and Europe and large and small companies are being invited to participate in one of the most dynamic migraine clinical trials ever undertaken. For further information about Curelator Headache or to find out how you, your patients, or your company can participate, please visit curelator.com/trial or email trial@curelator.com.